here. You're gonna have to put that out.
Fine. Save that for later. Come in.
Hi, I'm Nurse Elise. Can you tell me your name and birthday?
I'm Murphy Smith, and it's February 16th, 1960.
Okay, and what are you coming in for today?
It's just like my annual checkup, but I don't know. I feel kind of like different than I have been. Like in these last few months, it felt kind of weird. You know?
Different how? We're gonna get some vital signs on you.
Well, I've been having to like nap more, but I mean, I'm fine with that because naps.
And you're having any shortness of breath?
Just when I like walk up a couple flights of steps, no big deal, you know.
Okay, I'm gonna get a blood pressure, tight squeeze.
Okay.
Okay. Your blood pressure is 148/92. That's a little bit high.
Yeah, it was like that last time I came in too.
Okay, I'm gonna
Thought it'd be
listen to your heart rate too.
normal by now.
And your heart rate is 106, so that's high too. Do you have any history of any cardiac problems?
Not me. I mean, my dad had like heart failure, but
Okay. All right. I'm gonna give these results to the doctor, and he or she will be in a minute or two.
okay. Thank you.
Okay, so I just saw patient Murphy Smith. He's a 59-year-old male. He just came in for a checkup. He's got, some things going on, maybe his heart. Blood pressure was 148/92. Heart rate was 106. So I would just go in there and check him out, see what's going on.
Okay, I'll go in, take a look.
Come in.
Hello, sir. I am
Hi.
Dr. Downey. Nice to meet you. So what's going on here?
I don't know. The nurse said something about like high blood pressure or whatever that means.
Okay. Have you had any other symptoms?
I don't think so. I mean, she acted like it was a big deal that I get short of breath after one flight of stairs.
So some shortness of breath, and then have you had any fatigue? Have you been tired at all?
I mean, it's manageable with my 2 naps and my coffee. Like,
So from what I'm hearing, some fatigue, so you need some naps, and then have you had a cough at all? So a little bit maybe?
Maybe. I mean, you could say that.
Okay, so a little bit of a cough, and then I saw in your chart that you've had a high blood pressure and heart rate earlier today and once before.
I guess.
Okay, I'm going to take a listen to your lungs here.
Okay.
Your shirt smells awfully good there. What detergent do you use?
Downy.
Interesting. So, yeah, I don't hear any crackles or anything like that, but since you do have some shortness of breath and a little bit of a cough here, and with that high blood pressure, I'm going to diagnose you with some hypertension here.
Oh.
And then we just want to prescribe you with a medication here. It's an ACE inhibitor, Enlapril, and we're going to give you 2.5 milligrams.
Okay.
And you're just going to take this as directed here. I have your medication here for you. You can read on the label there how you take that.
Oh. Okay.
Okay, do you have any other questions for me?
Well, I know my dad actually had that hypertension thing you were talking about, and then ended up getting something called like heart failure.
Yes, we want to make sure you take this medication and to keep your blood pressure down, and so we don't end up with heart failure. That could occur if we don't take that medication.
So I should take this.
You know, Dad, I'm super proud of you. Stop drinking, stop smoking, taking your medicine like you should.
I just want to be healthy for you.
You know what? Look at this. Health fair. 9 to 11. Let's go see how you're doing.
All right.
Hi, welcome to the health fair. My name's Abby. I'm just going to go ahead and sign you up before we get you all checked out, okay?
Oh, okay.
Can you tell me your name?
Murphy Smith.
Okay. And can you tell me your age?
I'm 59.
He's old.
All right. And do you have any diagnosis that you're aware of?
They had me taking these. I don't really know what it's for. I think like hypertension or something.
Okay, we're gonna have the nurse check you out, okay?
Oh,
So
okay.
you just wanna follow me over here? We'll have you sit right there. Hi Murphy, you can take a sit right here. I'm gonna go ahead and take your blood pressure, okay?
Oh, all right, moment of
Just
truth.
relax,
Am I right?
How have you been feeling today?
I feel great.
That's good to hear.
Like $100. I
Wow.
wish I had $100. Am I
Yeah,
right?
don't we all? Okay. Just go ahead and take a listen here. Your blood pressure is good. It's 118 over 64. That's normal. We want a blood pressure below 120 over 80.
That's awesome. I'm so proud.
That means those medications that you've been taking are starting to work.
Cool.
Yeah. Is there any questions you have for me?
I don't think so, no.
Okay. Well, you have a nice day, Murphy.
All
Okay.
right, thanks.
You're welcome.
So I don't need these anymore.
Where are we going now?
Let's
Did you just throw your medicine away?
Well, I don't need it anymore.
No, you've been
because-
doing so well.
But I'm fine now.
No,
My
no.
blood
What are
pressure
you?
was
What are you
good.
doing?
It was. We gotta celebrate.
Are you
Let's
drinking?
celebrate.
I just told you.
Yeah, but it's
No,
fine. I'm
no.
healthy
What
now.
are you doing?
Listen.
I can't even believe you.
Let's just go
No,
home.
no. I'm leaving you. Stay.
Don't be like this.
I'm being like this.
Man, this is really an incline.
Why are you taking so long? It's really not hard to breathe. I'm not waiting on you. I'm done. Nope.
Why do you have to be like this? Do you remember when you were proud of me?
Nope.
Come in.
Hi, Murph. It's Dr. Downey again. I've heard from the nurse that you're having some more symptoms like before.
Yeah, it's like pretty bad this time though.
Pretty bad?
Yeah.
Okay.
It's really bad, yeah.
It's really bad?
Yeah.
Are you the daughter?
Yeah, I'm the daughter.
Hi, Dr. Downey.
Don't listen to anything she says. She's
Oh, okay. I'm just going to take a quick listen to your lungs here.
okay.
Okay. I'm going to pull up a chair real quick so we can chat. Now, Murph, from what the nurses have been telling me, you're showing some edema, swelling in your feet and legs, and you've had that fatigue and shortness of breath going up steps.
Yeah.
And you still have that high blood pressure.
Oh, is it still high?
It's still high. And you've been having, from what I can hear, some crackles in your lungs, like you've got some fluid in there.
In my lungs?
Yes,
Mhm,
your
that's what I
lungs,
heard.
yes.
I feel like that's not good.
Yes, from these symptoms, I'm going to have to diagnose you with some congestive heart failure.
But I mean, it's beating. So how is it failing? Because like it's working.
It
like,
is, but you have that high blood pressure and everything, so you do have some heart failure.
What does that mean?
So Murph, because of this diagnosis, I'm going to have to prescribe you some medications. So you're already on that ACE inhibitor.
I don't have that anymore.
You don't have that at all.
He
no?
threw it in the trash. Yeah.
My blood pressure was fine.
Fine.
Okay, well, I'm going to get you another dose of that, and we're also going to put you on a beta blocker and a diuretic. You're going to have to take these medications every day. And we're going to have some lifestyle changes to help with these symptoms, too, on top of the medications. We're going to have to totally stop smoking.
Stop?
Yeah, no more smoking, and you're going to have to only moderately drink.
So like 2 or 3 a day.
About 1 to 2 drinks per week.
A week?
Mm-hmm.
Like drinks.
Like normal sized drinks.
I can't do it
And do you exercise at all?
I mean, does walking to the fridge count?
That's funny. That's really funny.
No, we'd like for you to exercise about 3 to 4 days a week for about 30 minutes, even if it's just some light walking.
We'll go walk your dogs or something.
Okay, I guess I can do that.
Do you have any other questions for me?
No, I don't think so. Will this like cough and stuff go away?
The medications will help with it. And the nurse will come in soon to educate you on these medications.
Okay.
Hey Doc, what do you guys use this Downy for?
Oh, it's probably to like freshen up the room, I guess.
Downy. Okay, I'll see you later.
Hey Murphy, my name's Abby. I've got your medication here for you.
Okay.
So the doctor wants you taking this ACE inhibitor.
Oh yeah, that again.
Yep, you're gonna put you back on it,
Don't
and
throw it away this time, please.
this will help decrease your blood pressure.
Okay.
It's also putting you on a beta blocker, which helps a little with the blood pressure, and it also brings down your heart rate since that's been pretty high.
Okay.
It'll help that heart from having to work so hard. And we're also going to put you on a diuretic, which will help get that fluid off of you, and help with your cough, with those
Okay.
crackles in your lungs.
Good.
So things that you want to watch with all these things is when you're moving positions from like lying to sitting up, it could decrease it a little too much, and so you might get a little dizzy. So just do those things slowly.
Okay.
It's nothing to be concerned about. Just do it slowly so you don't have any falls.
I do everything slowly, so.
Okay, well, these should help you feel better. So hopefully,
Okay.
you just have to be taking them daily. Take them as they're prescribed. It tells you on these bottles how to take them, what time every day.
Okay.
You have your daughter here with you that I'm sure she'll be more than willing to help you. Hopefully.
We have to get you better.
We do.
Alright, we'll see you back here in about 4 weeks, okay?
Okay.
Alright.
Thank you.
You're welcome.
I feel much better now.